Go to www.agelesshealth2012.com for your special invitation.
Do you suffer from the debilitating symptoms of chronic pain, swelling, and loss of joint motion due to arthritis? Are you taking drugs like Celebrex and Vioxx or other super aspirin prescriptions? If you are, you're increasing the risk of heart attack and stroke by up to 50%. This is Dr. Tom Roselle, host of Dr. Tom Roselle Live Sundays at 12 noon. Why live with pain or the dangerous side effects of drugs when the doctors at the Roselle Center for Healing, practicing 21st century integrative medicine, can help you experience relief like never before? Simple, safe, chiropractic, acupuncture, and nutritional care can provide significant relief from arthritic pain in less than 6 weeks. More than 70% of our patients experience a return to life far beyond their expectations. Give yourself the best gift possible, freedom from arthritic pain, naturally. Call today to schedule an appointment. Call 703-698-7117 or visit online at rosellecare.com.
Dr. Tom Roselle Live right now on 105.9 FM and AM 630 WMAL.
Good afternoon. This is Dr. Tom Roselle Live, but Dr. Tom isn't here. He's out teaching this weekend. So the girls have taken over the studio, and I am Sue Roselle. And here with my guest today is Stephanie Pina, a repeat performance from last week. Hi, Stephanie.
Hello. I'm getting used to this.
I know. We are going to talk today about a couple of different takes on a topic that's near and dear to my heart and my stomach, obviously food. And we're going to look at it from two different perspectives, both from the Western medicine, but also from Eastern medicine perspective. I do want to tell you before we get started on that remind you about the Ageless Health Seminar that's coming up in October 20th at the Fairview Park Marriott. It's going to be a fun-packed, very high informational-packed day. Put it on your calendar. Don't forget, if you can register online with rosellecare.com, that's rosellecare.com, there is a discount to do that, and hopefully you can make it because it's going to be a fantastic day. It's a busy, busy day for everybody. Stephanie.
Yes, good afternoon.
Are you there?
I am.
We're going to talk about a couple of different perspectives on something that I think people kind of put in the back pocket as far as understanding how it affects their overall health, and that's the fact that food, which is the first and original medicine of mankind, still exists as one of the most important things.
Yeah, it's very interesting. No matter what type of medicine you looked at, what type of culture you're have either researched or kind of seen what their traditions are, food has always played a huge part in not only the healing process, but actually what makes that culture special and unique. So the way they prepare it to what's available to them, we kind of look at food as something that we just eat and you have to go through from, breakfast, lunch, and dinner and snacks, and sometimes it can even get in our way of doing everything else we have to do in our busy lifestyle. But unfortunately, food itself is this medicine. We've known that for a while, and we know that there's a lot of different properties from different perspectives that can kind of help out with the whole healing process.
Absolutely. Even more so now than ever before, the science in Western medicine is researching why foods do what they do, how they have the effect on our bodies that they do. And we know, and we're not talking supplements at this point, we're talking about good old food, the thing that fills your tummy when you're hungry and keeps you going and gives you the energy to do what you need to do. But with this modern manufacturing skills that we have today and the conveniences that we have, some so-called conveniences that we've placed into our diet, we are beginning to see an impact on not only our health overall and the rise of the degenerative disorders as we get older, but also some of the reasons why, the etiology behind that. We know that food has given us energy forever, and we're talking, your proteins, your carbohydrates, and your fats, and we eat those things to keep our bodies going, give us the energy and the strength for us to keep on going, even though it's an inconvenience a lot of times. I'm too busy to eat, I don't have time to make food, all of that sort of the usual complaint about it. But The point is, we know that certain foods, when you eat them on a regular basis, have a capacity to actually alter your health. They have the ability to raise or lower blood sugars depending on what foods you choose. We know that it can stabilize or raise blood pressures. We know that it's a root cause for inflammation and therefore also cholesterol elevation or decreasing the cholesterol. There's been a lot of studies done over the years, specifically with diabetes, that diet and activity are as effective as oral medications in many cases. Now, that's a pretty heavy thing to say, but they have identified that. And so you can make or break your health. The foods you choose can raise your inflammation level or it can lower it. It can alkalinize your body and make you very unfriendly to diseases and cancers, or it can make you acidify, and that will create the terrain that makes you viable for any kind of a number of illnesses that can happen. The problem is getting the right balance and the right distribution of the kinds of foods. And then we talk about organic foods versus the conventional foods and how they make a difference in our eating pattern. And of course, the higher the nutrient value of a food, the more it can have an impact. But when we talk about food as medicine, we're actually talking at the very cellular genetic level. And we have many studies out there and even more in progress showing how food can actually alter your genetics. In other words, you've got genes in your body that say be healthy, and you have genes in your body that say get sick. And food is one of the most powerful things that can make a difference on which genes are talking. And it's through the messages that food presents. Now, that's a Western perspective on how we look at foods. It's coming to be more and more important as we are all striving to take the bull by the horn, so to speak, as keeping ourselves healthy and allowing us to maintain longevity and vitality well into our 80s and 90s and maybe even 100. But the Eastern medicine, which is one of the oldest forms of care for people, have looked at food for eons and understood the powers behind how that food can alter the body's balances and make, again, its health or disease process come through.
Yeah, it's been very interesting because especially Chinese dietary therapy, it's part of a whole medical system. Most people are familiar with, the acupuncture point, even the herbal part, which we talked about last week. But even exercise and nutrition play a huge part of essentially the healing process. And when you look at it, it can be much more simplistic than the way we think about clinical nutrition right now. I mean, the basic properties are the same as it is with any of the other therapies where you want to keep the body in balance. So whether you're using acupuncture points to kind of move blood and qi, basically you want to use food to keep that person at a right temperature, keeping the functions functioning properly, and essentially going from there. So when you look at really breaking down food substances, a lot of times it comes down to two different things. You look at what the temperature of the actual food is and also what their taste properties are. And different tastes and different temperatures can go into the body and affect different organ systems. For example, we think of salt and the fact that we add salt to something, a seasoning and taste to us. But when you use it with certain foods, it can also go in to harmonize the kidneys, where that's exactly where in our body salt's being removed from the system. So we know that if we want to strengthen the kidneys, we can add a little salt. However, we also know with the fact that salt can have a big influence on blood pressure. You take too much salt in and you're going to have the reverse effect, and it can improve and it can thicken the blood and actually cause more blood pressure problems than helping. So there's this fine balance between how you use foods, their taste and temperatures, which we're going to get into, and essentially their therapeutic properties, and keeping that balance between hot foods, cold foods, and neutral foods, and then the different tastes such as bitter, sour, sweet, and even bland.
That's something that we touch on as well with the people that we work with, not doing Eastern medicine nutrition, but from a Western standpoint, a lot of the time when I have patients that have problems with digestion, they're having difficulties with GERD, or they're having trouble with irritable bowel, or they're just really, really depleted, very, very sick or very, very weak. We know that when those people eat a very basic combination of foods, not get too many different varieties in the same meal, that they eat small amounts of food at one time so they don't put too much stress on the digestive tract, and that often that they use lightly cooked foods, if nothing else, to help them with that digestive process. Since raw foods are harder and colder, it takes more energy, and those people often don't have good energy in order to do the digestion.
A great example that I used to always talk about was thinking about sushi for the starters. And when you have sushi, you have cold raw fish. You know, it's wrapped in rice. Everything's very kind of starchy, hard to break down, and so it's going right into the stomach and kind of sits there. And when you think about it, sushi isn't just normally served by itself. It's usually served with some ginger. It's usually served with some warm tea or even sake. It's usually served with some Worcestershire. Essentially what those herbs do are basically you're taking foods to kind of help warm the stomach up and prep the stomach so that you can break down that food that's a lot easier. They also used to add in, of course, to help decrease any kind of parasitic involvement that might be in the actual raw fish. But we see that there's a balance between taking a cold food and then putting it with warmer substances to help it break down in the body. So basically you have to look at the stomach and the digestive organs like it's a big bowl of it's a big fire and a big cauldron. The more ingredients you add in, the more you kind of make that cauldron warm enough to break it down, the quicker it's going to be able to process, the more you're going to be able to get to the good stuff. So overall, like the way you look at foods and the way you process them can play a big difference on how things affect the body itself.
So that's why they give you wasabi and ginger when you have those rolls.
That's why most people, when they're eating that, they're not necessarily just picking up this piece of sushi and they're eating it. They're using it with some of those warmer textures and flavors that kind of help nourish the digestive tract as well. A lot of the times, too, if that cold, hard food's sitting in the stomach, you'll notice that after you eat sushi for a while, you kind of start feeling a lot hungry than if you had a big warm meal, and all of a sudden you feel like you got to fill up again in a couple hours later. It's because the body's not being able to process it correctly. So,
is that what they call the Chinese syndrome, when you get hungry an hour after you've eaten Chinese food?
Exactly.
I always wondered why they put those things together. I just thought they tasted good together.
It's all about balance.
All about balance. I want to remind you listeners, if you have a question that you would like to ask either me or Stephanie about diet or how foods can impact your health, if you have a concern or a problem that you're trying to modify or correct, please give us a call at 888-630-9625 or 888-630-WMAL, and we'd be more than happy to take your call. We're here to talk with you and to answer your questions and help you along in your quest for using any number of methods to keep your body healthy, strong, vital, and ageless to 120, which is what we're supposed to live. Do you think eating sushi will do that?
I think you need some more balance other than just doing that. You know, when you look at the overall diet, you know, a lot of the Chinese medicine diets promote much more, you know, grains, grains and vegetables, and they have a higher fiber content in overall. They also look at basically using foods that really taste really bland to us, that we're not used to. We're used to, you know, something that seasons and tastes good. But bland foods in itself can be the best foods to eat when you're actually feeling sick. Like everything from, you know, a really basic chicken broth up to congee, which is basically just a fancy word of saying watery rice, essentially. I've had patients that basically will start on something that's very bland and allow their system to have food that's just easy to digest so they can focusing on the health and healing factors.
And that's when food comes in as providing the energy for the immune system to do its job and get out of the way of other things that it has to deal with, the digestive tract has to deal with by more complex meals. It's very hard work to digest. In fact, that's part of the reason we don't feel so good as we get older with our digestion, because our bodies are gradually losing some of its vitality and energy, and we just don't have the strength for good digestion like we did when we were 20. I always say you can't get away with what you do at 25 when you're 45, 55, or 65, and it's partly that.
We also know too that our tastes change as well as we get older. Our sense of taste and perception and smell are also going to change. So that's going to make a big impact on what we choose to eat. So variety becomes a much difficult time to add in because we get used to our favorite foods and stuff, and then even that can bring out different issues as far as sensitivities to certain foods and stuff as well.
Absolutely. Welcome back to Dr. Tom Roselle Live, and you are on the right station. It's just the girls have taken the studio over for the day. I'm here, Sue Roselle, with my guest Stephanie Pina, and we're talking about the effects of food as medicine. Stephanie, we have a couple calls on the line, so let's take those before we keep going here. Manuel from Springfield.
Hello. How are you doing today?
Fine, thank you.
I'm just wondering if you ladies have heard of Dr. Joe Furman and his book, Eat to Live?
I have not read it. I'm familiar with it and the concepts behind it, which I believe are basically nutrient-dense foods. In other words, foods that have very, very high nutrients but relatively low in the calorie intake. Using it for calorie restriction and also as weight loss as well as health-promoting situations. Is that pretty much summing it up?
Yeah, I was wondering what your opinions were of his health philosophy.
Well, I haven't read the book, so I really can't officially formulate an opinion other than the fact that I will tell you that there is a lot of research going into nutrient density, which means lots and lots of nutrients but very, very little calorie content, which is basically a lot of your vegetables and fruits, and restricting some of the calories significantly below what we normally think of to increase health and longevity. And there are some really positive studies about extension of life as well as extension of health with calorie restriction. Stephanie, do you have any comments about that?
Well, I think you see a lot of I also have not read the book, but I'm a little familiar with it, and essentially I think you see a lot of the information be put out there, and it's the same information in different ways. And I think the good thing about it is that these books exist because essentially people are getting more and more informed about how their food choices are really going to be important. So when you look at what types of food to combine with, you also want to look at when you're actually eating them. So not only do people try to get the ones that are lower, the foods that are lower in calories, you also want to make sure too that you're eating properly at proper times to make sure that you're constantly still maintaining that energy source throughout the day as well too. That's a typical Chinese medicine prof kind of idea and principle as well too, to keep that qi up.
Mm-hmm. And it's kind of taking the sting out of some of the crazy diet foods that are out there that are designed solely for weight loss purposes, but kind of ignore the importance of your nutrition. All the boxes of prepackaged dinners and meal replacements and bars and just some of the junk food that's out there that is there under the guise of being healthy for weight loss. In fact, many of them are not, and anybody that's ever ventured into that realm of food knows that it doesn't taste very good. Emmanuel, I thank you for your call and hope that answers you and gave you a little perspective from our position. Stephanie.
Let's go ahead and take the other call while we have it on here. So we have Bonnie from Springfield.
Hi. My daughter tore her ACL early this summer and needed knee surgery, and as a result also needed some heavy pain medicine for a short time. It's been about 3 months since she stopped taking the pain medicines, but they injured her digestive system, and she's having, anytime she eats food, she gets upset stomachs and diarrhea and things like that, and I was wondering what you might recommend to help heal after all this.
Well, it's kind of interesting because I think she's got age on her side, that's for sure, because essentially we see this even with older adults who go into any kind of surgery where they're given this heavy medication to kind of deal with some of the side effects from the actual surgery, but they don't think about the fact that it has to be broken down in the stomach and in the liver. And that in itself, especially if it's a short period of time, can be very disruptive to not only the good bacteria in there, but the actual linings and help up with the absorption. So a lot of times people have these lingering symptoms that continue to happen. The best thing that really helps with that is to really do basic foods and to kind of use things like L-glutamine and to kind of use things that are going to help repair the actual gut and kind of go from there.
Also, we're going to have to break from a message here in a minute, but just wanted to put in there keeping away from foods that are irritating to her, allergy foods that she may have, and also most pain medications are going to be irritating to the stomach lining, and so we need to get that healed. That's what Dr. Stephanie was talking about with the L-glutamine powder and so forth. But a good clean diet, easy to digest foods. Again, we're talking cooked foods, pretty much on what we were talking about a little bit while ago, not putting large amounts of food in at one time and skipping meals and going for long periods in between. Those all may give her a little bit of relief. Welcome back to Dr. Tom Roselle Live. And today, this is Sue Roselle, and my guest Stephanie Pina are sitting in for Dr. Roselle, who's off roaming the country doing his teaching thing. I wanted to remind all of you again about the Ageless Health Seminar coming up October the 20th at the Fairview Park Marriott. We're going to be talking about a lot of really important things and some things that even go along with what we're talking about today. My program, as a matter of fact, is going to be how to eat well on the run, because everybody's telling me I don't have time for cooking, I don't have time to eat. Well, we better take time, because food is medicine, and that's our topic for today with Dr. Pina. But we will also be finding out about the emotional side of healing, the common origins of diabetes, arthritis, and heart disease. Yes, there is one common function that causes all three of those things to come about, and as well as some other things that happen to us. How an injury to our body has an effect on our overall systems and our health. The emotional side of healing, a very important part of why we don't always get that 100% correction. So it's going to be a fun-filled day, lots of information to use, lots of tools. When you walk out that day, you will have all kinds of handouts and information that you can go back and review and actually put into effect on your own. I also want to remind you that you can register either by calling our office, 703-698-7117, or go online to rosellecare.com and register, and you get a little bit of a discount there. If anybody has questions today about diet or how food is affecting their health, please give us a call. 888-630-9625. That's 888-630-WMAL. Dr. Pina, we've talked a lot about how foods affect us and from our Western world perspective, but tell us a little bit more about how the Eastern medicine looks at food as medicine.
Well, it's very interesting because, first of all, let's break it down to the actual organ of digestion, because when we think of digesting food, we think it goes from the mouth to the stomach, then through the intestines, and then out, basically. One big, long tube. Well, in Chinese medicine, the main organ that basically governs the whole digestive tract is actually the spleen. And, you know, from what we know of in Western medicine, the spleen is really kind of seen as this partial lymphatic organ, it basically has to do with being almost like a filter, but it does have immune functions as well too, because part of that filter process tells us what's good for the body and what's not. But the Chinese have a very different way of looking at it. It encompasses the entire digestive tract, so basically it's paired up with the stomach and with the intestines. So they are, without even knowing that there was a connection between the immune system and the stomach and what we eat, they knew that there was a connection there. So essentially you can affect both organ systems, the immune system and the digestive system at the same time by influencing it. And the best way, of course, to influence is by the foods that we eat, the herbs that we take, and even sometimes the supplements that we use to basically add in. So when you look at Chinese medicine overall, there's a lot more to it as far as how it can boost your overall health and healing. Now, we talked a little bit about the properties of how cold foods and how hot foods can affect the system, but essentially it's kind of, I always get the questions about, well, what is a hot food versus a cold food, and how can you make foods change temperatures? And one of the ways you can do that, obviously, is by processing it. So different kind of cooking techniques. The longer you put food under, intense heat for a longer period of time, the warmer it's going to be in the body. So those types of foods are actually going to be good for someone who's a little bit more cold natures, that that is fatigued, that essentially tends to be on the colder side, that kind of always have that internal chill, versus someone who's always kind of hot-natured or is having hot flashes and stuff. You probably would want to stay more towards the cooler, neutral type of temperatures.
It's kind of like not wanting to have chili when it's 95 degrees out.
Exactly. It's very basic. If you're cold, eat some warmer foods. If you're hot, doesn't necessarily mean eat cold foods, because again, that can slow down the digestive tract. But you want to stay towards less of that hot spicy food.
Got it.
And one way of kind of thinking about that and comparing it to Western medicine could be almost looking at the acidity levels. Colder foods may be seen more as the alkaline type of foods, where hot food may be seen more as an acidic type of food.
So that has a difference in the heat of the body.
Absolutely. And what's interesting, too, is even I have a lot of discussion with people about different types of meats and stuff, too, and you would think that chicken is always the best thing for you. It's a white meat, so it must be cold in nature. And I said, well, if you think about the live chicken running around all the time, it's very active. So it's taking on the energetics of that live animal. So chicken actually tends to be very warming in nature, so that's why it works well when we have colds and flus, to kind of break it down into its most simplistic areas, versus lamb is actually, since it's a very young animal, it tends to be some of the warmest meat out there. So if someone was looking at how do you put, white meat versus red meat in there, there's a lot of differences in between different types of temperatures and how you can adjust foods and stuff. And there's a lot of great references out there as well, too. One being, actually, it's a book that you see quite a bit, is the Healing with Whole Foods book by Paul Pitchford. I don't think I've gone to some of the markets and not seen that book out there. There's many editions out there, so it's definitely a great resource to use if you want more information about that.
Yeah, it actually gives you a lot of the information about what the foods can do to change the temperatures of the body and change how the immune system works. So I guess there's really something to it, even in Eastern medicine, for chicken soup and the flu, huh?
Absolutely.
Everybody make a pot of chicken soup right now. We have a couple of phone calls on the line right now. Michelle from Tyson's Corner. How can we help you?
Hi. I've been following mostly a fruit and vegetable diet, and it's been working out very, very well for me. And then I've been eating salmon with like a very mixed salad in the afternoon, and it's really helped my energy level. And then I've also been going to the gym to the point where I've been feeling fabulous. The only issue I have is sleeping at night. I guess my energy levels are so high, but I can't relax my mind. And so I know something's out of balance, but all my cravings have disappeared, which I love, because, I'm losing the weight that I want to lose, and there are no cravings, but the only problem is I can't sleep at night.
One of the first questions I would know is, when do you usually exercise during the day? Do you tend to be one that exercises more in the morning, or are you later in the afternoon?
I'm like right around noon.
Okay. So one of the things right there could be actually changing the way the adrenal glands are actually function as far as keeping you awake at night, because the more you put that exercise later in the day, the more you're re-stimulating the adrenal glands. So you can be eating all the right foods, all the right properties, but essentially that whole part of the adrenal gland system that kind of helps us to tell us when to kind of shut down the body and basically go into sleep could be basically being re-stimulated in that middle of the day, where it starts to actually slow back down. The other thing, too, that could be that some of the, what do you tend to do is later on, do you have any snacks or anything in the evening, or a heavier dinner?
No, I eat late afternoon, like around 4-ish, and then I stop for the rest of the evening. And then I might have herbal teas, but that's it. I don't eat late at night.
Okay, one of the things that might be happening as well, since you're expending a lot of energy early through your day, and then you stop eating early in the afternoon, or actually early evening at 4:30. There's nothing wrong with that, except you have a very long haul between the time you stop your last meal of the day and breakfast the next morning. And if you don't have enough storage of fuels in your system, you may actually be dropping blood sugars early, and that's going to stimulate adrenals to activate cortisol and adrenaline to get some fuel into your brain to keep you functioning through the night. Sometimes when that happens, this is often the cause for people to wake up abruptly in the middle of the night and not be able to go back to sleep. We years ago used to think about the midnight rate on the refrigerator, but there is some truth to the fact that you may need a little bit of a snack a little bit later in the afternoon, or little bit later in the evening. Giving yourself a couple of hours between the snack and the time you go to bed, but just something to give your blood sugar a little bit of a boost for the later part of the day. Again,
what would you recommend? Would you recommend something like a banana or something like that? I don't want to change my food cravings.
No, you don't want to.
Working so well.
The fact that you've gotten high nutrients into your system is part of the reason you've lost your cravings. However, something that's easy to digest, perhaps something that is warm. I know that cooked food is a lot easier on your digestive tract later in the daytime, so perhaps, a bowl of homemade soup of some sort would be a good thing to have in the evening with lots of vegetables, a little bit of protein in it, but something to give you a little bit of a branch between the 4:30 meal and breakfast the next day.
Okay.
Michelle, I hope that helps you. If we need to help you any further, you want to speak with us more, feel free to give us a call at the office or contact us on rosellecare.com. Thank you very much for calling. Linda?
Hi.
Hi.
Hi, thank you. I recently found out that I'm dealing with Hashimoto's disease.
Uh-huh.
And I don't have a weight problem at all. In fact, I might be a little maybe on the lower end. I'm 5'4.5" and weigh between 105 and 108. But I get up very early, and my snacks tend to really revolve around a lot of cashews in the morning, and I'm always reaching for cashews as a snack. And I thought I read something where nuts maybe it's so great with Hashimoto's, but I'm just trying to figure out whether this is something good for my body or something I should really lay low on.
Well, one of the things I would suggest is not always using the same nut. Since nuts happen to be one of the top 5 most allergenic foods, rotate them so you don't get sensitive to them, okay? And when you have a Hashimoto's, it's an autoimmune disorder of the thyroid, that also indicates that your immune system is a little bit at risk for developing sensitivities. So keeping, rotate, say, almonds and walnuts and pecans and with your cashews. Now, you may want to be careful about soy nuts and soy products because that does have a tendency to alter thyroid function, and you don't want to do that. Mm-hmm. But more importantly, are you eating anything with gluten in it?
No, I have gotten away from. I have cut out the gluten. It's been about a year, so I have cut the gluten out.
Okay, there's a direct link with gluten in all of the autoimmune disorders, and so you definitely want to keep away from that. But good raw nuts or sprouted nuts or soaked nuts, all of those work very nicely as good snacks. They give you good fats and good fiber and help balance blood sugars, and that's a huge thing to do when you have an autoimmune disorder. But rotate them. Don't eat the same one. And peanuts are not considered a nut, by the way.
Right. I'm not supposed to eat those, so I stay away from those.
Right.
So,
right. Okay.
Okay, great.
Thanks for calling.
Thank you so much.
Well, one of the things I think is interesting is we talked a lot about Ageless Health and how we have some great speakers, and all the doctors that you hear here on the radio show are going to be there, including Dr. Roselle. And unless he has another trip, but I don't think
he'll be
this
there.
One. I think he shows up for this one every year.
He shows up for this one.
You can see him in person. But one of the great things, too, is we actually have a new doctor on staff. I'm sure you'll be hearing him on the radio very soon, Dr. Matthew Adams. And he's actually going to be speaking today at the same location where we have Ageless Health, at the Fairview Park Marriott. The Pathways magazine, some of you might be familiar with that, is having their Natural Living Expo. I believe it's from 10 a.m. to 7 p.m. And the Roselle Center Feeling, we have a booth down there. I think it's number 86 when you walk in. You can come in and say hi to us. And also, he's going to be speaking on the holistic treatment of migraines and headaches, kind of looking at it from a number of different ways. So if you get a chance today and you're kind of inspired by what we're talking about now and you want to come down and meet us and ask some questions as well, he's going to be presenting from, I believe, 6 to 7 o'clock at night, so you have plenty of time to get down there. And like I said, it's the same area, same hotel where the Ageless Health presentation is going to be. And we're getting a lot of good questions on health and food and what should be eating. Like Sue said, she's going to be talking about how to eat on the run, which is extremely difficult, especially here because we all have late commutes, we all work late, and so we come in and we just don't know what to do with ourselves. So
and
it's
everybody's
much easier.
on the run.
It's much easier to stop and pick up something, but what do you do in those situations? So I encourage everybody, if they can't get out today, to go see Dr. Matt present, and then also stop by the booth and if you have any questions. Or you can also sign up at the office for Ageless Health, which is you can call in or do that online at rosellecare.com, or the office number, which is 703-698-7117.
Welcome back to Dr. Tom Roselle Live. This is Sue Roselle and Stephanie Pina holding down the fort today. Stephanie, we just have a few minutes before we're finished for the day. This program goes so fast. It's unbelievable. I know Doc always says that every week, but it really does go fast. Mm-hmm. I'd like you just to give us a quick summary, if you would, on what you would suggest for people. This is a transition season here in the fall time. Yesterday we hit 80. Now today we're barely struggling to get to 70, and it's windy and cool. And it's a great day out. It's beautiful. But that brings along with it a lot of health concerns and changes, and we are in a big allergy season right now. What would you recommend from an Eastern medicine standpoint for food?
Well, the main thing is you want to be nice to your stomach during this season, and that can be anything from, choosing to eat local organic, because obviously those are the foods that are being grown right now, that are at their peak prime being harvested. Gets a chance to also get out there while the weather's still nice to some of those farmer markets out there as well, too. And then you get to actually get hands-on and get to learn how to cook some of these foods. You can always talk to them too about how to prepare stuff. But you also want to make sure that there's that balance between hot and cold. On the summer days when it kind of still feels really warm, don't go out and eat the ice cream that you shouldn't be eating already, because it's colder on the stomach. When the temperature drops the next day and your body's still processing that ice cream, you're going to feel more results. I mean, ice cream is definitely phlegm producing, so if you're having allergy type of symptoms, dairy, heavy to eat foods, heavy greasy foods, all those are going to be kind of making more phlegm production in the body, so you might feel a little bit stiffly. You might have more of congestion as well, too. So there's a lot of different things to stay away from. If anything, you can go towards slightly the warmer types of foods, just to kind of help get the body basically prepared for the colder temperatures ahead.
Got it. And, of course, my favorite of all is make sure this is the time of the year to get your crock pot out, put a bunch of vegetables and a little bit of meat or a bunch of beans in there, and make some soups. If you don't want to eat them right now, store them up for later. It'll help a lot when you've got to eat on the run, but it'll also give you some wonderfully warming foods when the temperatures do fluctuate. This is a time for allergies. Anything you can do to take the stress off your system, a little bit more exercise if you're immobile. Don't over-exercise if you are an exercise fan, and eat regularly. Don't skip meals. Don't skip your snacks. Keep everything you put in your mouth. Make it have value. Remember, food is a very powerful medicine, and it can help you get through this period of time. Stephanie, thanks for being with me today.
It's been our pleasure. I think we did a pretty good job taking over the studio.
I hope so. I don't know if we'll do it forever, but we may let him come back next week. Thanks for all of you to listen today. Again, reminders for Ageless Health. Get online to rosellecare.com to register. And we hope to see everybody there. It's going to be a great time. Thanks for being with us this week, and we'll talk to you next week.
Are you looking for great tennis instruction in a dynamic, challenging, and fun environment? Hi, this is Dr. Tom Roselle, inviting you to visit rjtennis.com to learn about the most popular adult tennis program in the metro area. RJ Tennis programs are packed full of energy and non-stop tennis. With exhilarating drills and games, RJ Tennis will energize your game, fitness, and life. So call a friend and sign up today at rjtennis.com. That's rjtennis.com.
Did you know that breast cancer is on the rise and that routine annual mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? The result could increase the risk of developing breast cancer. Now, consider a simple, non-invasive, and totally safe adjunct medical procedure approved by the FDA, which can detect evidence of breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect initial signs of breast cancer, such as increased blood supply and metabolic rate, which is recorded as heat. Why expose yourself to radiation when accurate and safe medical detection is available? Call Thermography Centers at 888-485-7736. That's 888-485-7736. And for more information, visit thermographycenters.com.
The Roselle Center for Healing is a proud supporter of breast cancer awareness and reminds you to conduct a monthly breast self-examination and include a thermographic breast scan as part of your annual wellness checkup.
Suffering from chronic health problems? Tired of taking dangerous drugs? This is Dr. Tom Roselle, host of Dr. Tom Roselle Live. Join me on Saturday, October 20th for my Ageless Health Seminar, How to Live Well and Prosper in a Stressful World. And I'll show you how to increase the quality of your health and length of your life. Saturday, October the 20th at the Fairview Park Marriott Hotel, Falls Church, Virginia. Seating is going fast. Don't be left out. Register today at rosellecare.com or by calling 703-698-7117.